Understanding seizures starts with knowing what's happening inside your brain. A seizure is like a sudden electrical storm in your brain. Your brain cells, called neurons, talk to each other using tiny electrical signals. Normally these signals are very orderly, but sometimes this electrical activity can become too strong and chaotic. This sudden burst of uncontrolled electrical activity is what we call a seizure. It's a temporary disruption in your brain's normal functioning. Think of your brain as a complex computer. During a seizure, it's like that computer gets a sudden power surge. The effects of this malfunction can vary greatly. Some seizures might be hardly noticeable. Others can be much more dramatic, causing visible changes in behavior or movement. There are many different types of seizures. Doctors classify them based on where they start in the brain. Some seizures, called focal seizures, start in one specific area of the brain. Other seizures, called generalized seizures, involve all areas of the brain right from the start. Understanding this variety is key to understanding seizures. Recognizing the warning signs of a seizure is crucial. Seizure symptoms can be very different from person to person. Some symptoms involve changes in movement, often called motor symptoms. You might see sudden jerking movements of an arm or a leg. Sometimes the whole body might shake or convulse. Muscles can also become very stiff and rigid. Other symptoms don't involve dramatic movements and are called non-motor symptoms. A person might suddenly stop what they are doing and stare blankly into space. They might seem confused or disoriented. Some people experience strange sensations before or during a seizure. These can include unusual smells or tastes that aren't really there. They might see flashing lights or hear buzzing sounds. Changes in consciousness are also a common feature of many seizures. Early recognition is the first step towards getting the right diagnosis and support. If you feel a seizure starting, your safety is the top priority. Some people experience a warning sign before a seizure, called an aura. If you get an aura, try to find a safe place immediately. If you are standing, try to lie down or sit down. This will prevent you from falling and getting hurt. Try to get to the floor, away from hard or sharp objects. Once a convulsive seizure begins, and if you are with someone having one, help keep them safe. Do not try to restrain their movements. Instead, gently guide them to the floor if they are not already there. Move furniture, sharp objects, or anything they could hit. Place something soft under their head, like a folded jacket or a small pillow. Loosen any tight clothing around their neck. Never, ever put anything in the person's mouth. People do not swallow their tongues during a seizure. Trying to force something into their mouth can cause serious harm. Most seizures will stop on their own within a few minutes. If a convulsive seizure lasts longer than 5 minutes, call for emergency medical help. Once the shaking stops, gently turn the person onto their side. Stay with them until they are fully awake and aware. Section 4. Proactive steps. Preparing in advance for seizure management. Being prepared is a powerful tool in managing seizures. The first and most important step is to see a doctor. If you've had a seizure, a medical professional can help determine the cause. They can diagnose the type of seizure you are experiencing. Your doctor might prescribe medication to help control your seizures. It's very important to take this medication exactly as prescribed. Another practical step is to wear a medical identification bracelet or necklace. This ID should state that you have a seizure disorder or epilepsy. Educating the people around you is also very helpful. Talk to your family, friends, and colleagues. Explain to them what your seizures are like. You can share information about basic seizure first aid. Consider keeping a seizure diary. In this diary you can record when your seizures happen. Knowing your triggers can help you make lifestyle adjustments to avoid them. Section 5. Living well with seizures. Embracing a positive and managed life. It's so important to remember that having seizures, or a condition like epilepsy, does not define you. Many people with seizure disorders live very full, active, and rewarding lives. With the right management plan and a positive outlook, you can too. Modern medicine offers many effective treatments. These treatments can significantly reduce or even stop seizures for many individuals. The key is working closely with your healthcare team. Follow their advice and communicate openly about how you are feeling. Adherence to your treatment plan is absolutely vital. This means taking your medications consistently, as prescribed by your doctor. Finding support can make a huge difference in how you cope with seizures. There are many support groups available, both online and in person. Connecting with others who understand what you're going through can be incredibly comforting. Finally, focus on what you do, not what you can't. Engage in activities that bring you joy and fulfillment. Embrace each day with hope and determination.